All right, some medications that can increase some anxiety in some patients. So of course, some illicit substances like coke, meth, LSD, if you have a bad trip, or like marijuana in some patients can increase anxiety. But some medications that can also increase anxiety are thyroid medications like levothyroxine and liothyronine. This is especially when the dose is super therapeutic or too high. Some stimulants can also increase risk for anxiety, like your classic Adderall and methylphenidate, but also stimulatory medications like Wellbutrin and phentermine. Both of those can increase anxiety. Phentermine's for weight loss. It's an older medication. It's not used as often as the GLP mimetics are being used nowadays. SSRIs and SNRIs can also increase anxiety, more so at the beginning of when you start therapy. That sort of goes away with time. In about 3 to 4 weeks, I would say, it gets better. And then also every time you increase your dose, you can cause some anxiety in some patients. And then again, as I talked about in some of my SSRI video or SNRI video, venlafaxine is more activating at higher doses. So it has more norepinephrine increasing effects at higher doses. Another medication people don't think about is albuterol, especially if someone's using it like excessively. Like I see like almost every prescription come in be like 1 to 2 puffs every 4 to 6 hours is needed, shortness of breath and wheezing and stuff. And I'm like, that's kind of a lot. It's supposed to be used like maybe before exercise, maybe in acute exacerbation. It's not a maintenance medication. At higher doses, we lose selectivity and it hits that beta-1 receptor, increases that heart rate. So another medication or drug class are steroids, like your prednisone, dexamethasone, stuff like that. Prednisolone, those can increase the risk for some anxiety in some patients because it's so activating. And then antipsychotics too can sometimes increase anxiety. One that comes to mind is Abilify or aripiprazole, and then I'm going to lump Rexulti into that because they're almost the same medication. They can definitely increase anxiety because they have a higher propensity to cause akathisia. Akathisia is an internal restlessness that you get with certain antipsychotics, and it doesn't really go away. It feels really bad for patients. And then lastly, I'm going to mention, of course, caffeine. And then a drug similar to caffeine, it's another methylxanthine. It's theophylline. It's an older drug that we used to use for albuterol. That we used to use for asthma.